Hello, I'm Lion Tom McCarthy, Treasurer of the Minnesota Lions Childhood Cancer Foundation. Dr. Lucie Turcotte is a world-renowned specialist in childhood cancer survivorship, a pediatric hematologist, oncologist, and Director of Survivorship Research at the University of Minnesota Masonic Childrens Hospital. Dr. Turcotte received her master's in public health from the University of Minnesota in 2005, her medical degree from the University of Minnesota Medical School in 2007, and she completed her residency in pediatrics in 2010 at the Seattle Children's Hospital. She completed her fellowship in pediatric oncology, hematology, and bone marrow transplant in 2013 at the University of Minnesota Masonic Children's Hospital. Dr. Turcotte has chosen to stay at the University of Minnesota because it is a pioneer and leader in the field of research of cancer survivor issues. Dr. Turcotte's issues and research have focused on second cancer occurrences and short and long-term outcomes in childhood cancer survivors. She has specific clinical interests in childhood leukemia and lymphoma. Dr. Turcotte has been named a top doctor in both the Minnesota Monthly Magazine and the Minneapolis St. Paul Magazine. It is my privilege to introduce to you Dr. Lucie Turcotte.
Hi, I'm Dr. Lucie Turcotte, and I'm a pediatric oncologist at the University of Minnesota Masonic Children's Hospital. Thank you so much for inviting me to be a part of your annual meeting. I'm excited to share with you some background of our program, along with some of the research we are doing. I will also highlight how your generous support is helping move our childhood cancer survivorship program forward. The University of Minnesota has a long history of important contributions in the field of childhood cancer. Just to highlight a few examples, our Department of Pediatrics has consistently ranked in the top 10 pediatric departments in the country for successfully securing and carrying out federally funded research. And many of these funded projects are within the divisions of pediatric oncology and blood and marrow transplantation. The University of Minnesota performed the world's first successful bone marrow transplant in a child just over 50 years ago, and we have continued to pioneer new breakthroughs in transplant and cellular therapy technologies over time. Our hospital is the only center in the North Central United States to be designated as a Children's Oncology Group Phase 1 clinical trial center. This means that we are able to offer the most cutting-edge trials to the children with the most aggressive and difficult to treat cancers. It was also at the University of Minnesota that the Childhood Cancer Survivor Study was established in 1994. This is the largest cohort of childhood cancer survivors in the world and has provided much of the important knowledge about long-term health sequelae experienced by survivors. We use this information today to make important treatment decisions for our patients. The work that we here at the University of Minnesota have done, along with our colleagues around the world, has led to dramatic improvements in survival of children with cancer. As recently as the 1940s and 50s, childhood cancer was thought to be incurable. However, over time, with the efforts of cooperative groups, clinical trials have led us to the point that now 85% of children diagnosed with cancer can expect to become long-term survivors. There is now a growing population of survivors, with an estimated 500,000 individuals with a history of childhood cancer living in the United States. This means that 1 in 680 people is a survivor of childhood cancer. Unfortunately, as the population of survivors has increased, there's a growing recognition that they face serious health consequences because of their previous cancer therapy. We now know that more than 75% of survivors will develop some type of chronic health condition, many of which are serious or even life-threatening. And the risk for these conditions is typically largely determined by their previous cancer therapies. As our childhood cancer therapies have evolved over time, we have learned that it is important to combine different modalities of treatments to cure cancer. This includes surgery, radiation therapy, chemotherapy, and the newer immunotherapies, along with things like bone marrow transplantation. The dosing and timing of these therapies has been optimized over time to achieve cure, and we have also optimized our supportive care, including things like antibiotics, to keep children safe. However, All of these treatments, as I mentioned before, have contributed to the long-term health issues among our survivors, or the late effects, as we often call them. I think it is important to point out that there's really not any part of growth, health, or development that is not impacted by long-term by cancer therapy. I've listed some of the more notable organ systems here, and the knowledge of this has led to the development within oncology of a field called survivorship care. By having experts dedicated to researching and treating long-term cancer survivors, we have the opportunity to help them live their healthiest and happiest lives. I'm so proud of the work that I do as a survivorship researcher and as a pediatric oncologist. And I think nothing can portray the importance of our work better than highlighting a few of the patients I care for. The first patient I would like to introduce you to is Ava. Ava developed an unusual skin rash when she was 1 year old. She was eventually referred to our pediatric dermatology department at the University of Minnesota in fall of 2014 at 2 years of age. A biopsy was performed and confirmed a rare diagnosis called juvenile xanthogranuloma. While this is a condition that typically involves the skin only, it can also involve other organ systems. And so we as oncologists often manage these patients collaboratively with our pediatric dermatology colleagues. Ava was referred to me, and further workup revealed abnormal blood cells. Unfortunately, we found that these blood cells were a type of leukemia called juvenile myelomonocytic leukemia, or JMML. This particular type of leukemia is very aggressive and difficult to treat, and is only curable by bone marrow transplantation. You can see Ava on the left-hand side of the slide. On the upper left, she has the rash over her eyes and nose. That was the juvenile xanthogranuloma. And on the bottom left, you see Ava going through her bone marrow transplantation here at the University of Minnesota. Fortunately, Ava received her transplant with cells from her brother as a donor in February of 2015. She did remarkably well. Her transplant course was complicated by infections, including pneumonia, as well as poor nutrition. But she survived, and she was discharged. You can see in the upper left-hand corner, that's Ava shortly after her transplant. In the middle is Ava and her brother TJ, her cell donor. That was right before she started into preschool. And on the far right side is Ava on her way to kindergarten for the first time. As you can imagine, it's incredibly gratifying in my position to get to share these wonderful moments and these firsts with my patients because they have survived childhood cancer. And here's Ava today, again, with her brother TJ. She's now 8 years old and 6 years out from her transplant and is doing remarkably well. She is in the 2nd grade and loves to swim and play the piano. And when she comes to visit me in clinic, she likes to race me down the hall. We continue to follow her closely in the University of Minnesota long-term follow-up clinic. And we watch her for issues including extensive dental decay and abnormal tooth development. She has ongoing issues with learning, reading, and speech, and also requires close monitoring for other organ injury or dysfunction. But because we follow her closely and because we can catch things quickly, she is doing well. This photo is from a lovely day last fall when Dr. Kareem Sadak and I were presented with the incredibly generous donation from the Minnesota Lions Childhood Cancer Foundation. Our work is truly only possible with the philanthropic support from organizations like yours, and I want to highlight some of the specific projects and show you how your support has helped with our childhood cancer survivorship research. Our research portfolio has seen exciting growth over the last 5 years, and I'd like to highlight a few of our notable projects. One of the most important projects that we're working on is led by Dr. Kareem Sadak and is looking at transition of care. It's looking at individuals who, from childhood into adolescence into adulthood, are often lost to follow-up over time in their survivorship care. We know that that transition point in late adolescence is imperative that these children continue to receive care because that's a high-risk period for developing late effects. Kareem's work is helping to maintain patients in our system and maintain long-term follow-up care for them long-term. I'm leading a project looking at the bacteria that live in our gut, called the microbiome. We're looking to see how the microbiome impacts how we respond to cancer therapies and how that impacts long-term outcomes of health. We're looking specifically at complications like type 2 diabetes and hypertension. We're also developing a mobile application for survivors, and I'll talk more about this in a few slides, but we're focusing on providing education and resources for survivors, and this project is led by Dr. Kareem Sadak. As I mentioned earlier, we're a part of the Childhood Cancer Survivor Study where Dr. Neglia and I lead the Subsequent Cancer Working Group and design studies to better understand why childhood cancer survivors are at increased risk for developing subsequent cancers after their initial cancer therapy. I recently received funding through the University of Minnesota in collaboration with cardiology and pulmonology to look at physical function and exercise capacity in childhood cancer survivors. We've built a state-of-the-art exercise laboratory to study exercise and to hopefully identify areas for intervention long-term in our survivors. We also work within the Children's Oncology Group. It's a collaborative group of childhood cancer treatment centers throughout North America. We've developed treatment studies and observational studies to help understand the late effects of childhood cancer therapies. And finally, we've been fortunate to receive funding through the National Institutes of Health, and specifically the National Cancer Institute. Dr. Joe Neglia leads a riverboat study looking at long-term survivors of retinoblastoma, a type of cancer of the eye. I've led a study looking at breast cancer among childhood cancer survivors, trying to understand how these individuals experience their therapy and what their long-term outcomes are after a secondary cancer. I also have received funding to study the socioeconomic status and markers of chronic stress and how they impact our bone marrow transplant patients. So although I've only highlighted a portion of our active survivorship research, I hope you can see that we are very busy and continuing to grow. Our researchers, some of whom are shown on the right, including myself, Dr. Sadak in the middle, and Dr. Neglia in the bottom right, have recognized that our ideas and the number of projects that we are trying to launch were outpacing the research support staff's time and capabilities. We are very grateful for the Lion's support and have used a portion of it to expand our clinical research support staff. This allows us to have more studies open and available to our survivor population. It allows us to take studies from the idea stage into the reality in a much shorter period of time, such that a project needs to be written into a protocol, it needs to go through the ethical review process, and then we need to recruit and enroll patients. And all of those take the manpower that have to come beyond the three of us who are actually coming up with the research ideas. This support has also allowed results to be available more quickly for sharing with our survivors as well as our survivorship colleagues around the country. I wanted to specifically highlight the mobile application that is under development for our survivor population. This important project has primarily been led by Dr. Kareem Sadak, and your generous donation has helped make this project a reality. Kareem has been working with a consulting firm called Crux Collaborative to conduct user research with our medical providers and survivors to develop a mobile application for survivors, which will incorporate education, support, and logistical information to enhance survivor well-being and health. They have embarked on a 4-phase developmental process. The project is currently in phase 3. They have already conferred with survivors and survivorship providers to determine the most valuable information to be included in the application and the optimal organization and presentation of that information. They are currently developing the application prototype that will be used for pilot testing. We look forward to sharing screenshots of the interface design with you very soon. The final phase will involve testing the app with a larger group of survivors and providers to determine what additional adjustments are necessary before this is ready for widespread use. An additional study that we initially proposed to carry out using Lion's support is a study examining premature aging and frailty among childhood cancer survivors. We know that survivors are more likely to experience health conditions earlier and are more likely to develop secondary cancers at younger ages than other individuals in the population. They often have low muscle mass, feel more fatigued, and have weakness, and participate in less physical activity. We proposed a study of how blood markers of inflammation and cell death, along with genetics, impact strength, fitness, and neuropsychological functioning. Unfortunately, due to COVID-19 research restrictions, we have not been able to launch this study yet. But our goal is to begin as soon as it can be done safely in our clinic and research space. So, to wrap up, I'd like to share one more patient story with you. This is another patient who is near and dear to my heart, and her name is Sydney. At age 14, when Sydney was at ballet, she noticed a bump over her right shoulder. She was referred to orthopedics, where a biopsy was performed, and unfortunately, in March of 2015, was confirmed to be a type of aggressive bone tumor called Ewing sarcoma. I made the recommendation that Sydney undergo 11 months of aggressive chemotherapy, the majority of which was delivered in the inpatient setting, along with 5 weeks of radiation. Sydney completed therapy in February of 2016. It was intensive therapy and was complicated by weight loss, constipation, and having differences in her strength and sensation. Fortunately, after finishing her cancer treatment, she graduated from high school and entered college at the University of Minnesota. She is currently studying nursing and participates in the University of Minnesota Ballroom Dancing Club. She is scheduled to graduate in spring of 2022. She continues to follow up at the University of Minnesota Long-Term Follow-Up Clinic, where we follow her for ongoing issues with neuropathy, kidney injury, and risk for heart injury, as well as monitoring for secondary cancers because of her previous therapy. When I asked her if I could share her story, she was ecstatic and said she absolutely would love to have me share her story with you because she is so grateful for the care she received and the long-term survivorship that she has experienced. So with that, I will conclude. I want to thank you once again for your generous support of our program, and I look forward to sharing updates with you in the near future. Thank you so much.
On behalf of the Lions International members of Minnesota, working through the Minnesota Lions Childhood Cancer Foundation, it is my pleasure to present this check in the amount of $50,000 to support the work of the University of Minnesota Masonic Childrens Hospital in providing services and research for survivors of childhood cancer. We are so proud to be a partner with you in this noble endeavor.
On behalf of the University of Minnesota Masonic Children's Hospital and our Childhood Cancer Survivor Program, we want to extend a big thank you to the Minnesota Lions Childhood Cancer Foundation. Without your support, without all of your efforts, the research we do to change the lives of childhood cancer patients and survivors would not be possible. So thank you so much, and we're so grateful for everyone's efforts and contribution, and we look forward to sharing with you how we're changing the lives of these patients. Thank you.